The morning cars routine is the backbone of an FRC or kin stretch practice. The idea is we take every joint on our body through a big circle, through its greatest range of motion, doing a few things. As we've talked about, we're self-assessing, looking for closing angle pinching, looking for struggles disassociating one joint from the next. And two, we're building habits around starting our day with good mobility training and good movement. This week for homework, we're going to build off that idea. So not only is your homework to do your cars every day, we're going to add in capsule cars. So what we'll do is superset two movements for each joint and then move on to the next. Global car followed by capsule car. Couple reminders, other than self-assessment, we want to think about that MVC concept, maximum voluntary contraction. That was the idea of how much irradiation total body tension should we have throughout the body. If you're doing this routine in the morning, what we want to think about is enough tension in the body to keep everything still, but at the same time, we don't want to go too high intensity if you just woke up. So if we're doing this in the morning, that's what I'll be demoing. If you're going to do this more as a pre-workout or maybe a training stimulus, you can do it a little bit higher tension, get a bit more aggressive with it, but again, easy if it's the morning. Quick reminder, we want to irradiate throughout the body a little bit more than the joint that's moving. So we'll start with our wrists. So when we do our wrist car, irradiate some tension through your core and glutes, your quads, build up total body tension. We're going to start bilateral, so both palms to the sky just like this. If this kneel is not comfy position, you can sit if necessary. Nice straight fingertips. We're going to adduct, squeeze fingers towards one another. We're going to extend, driving fingertips to the floor. Abduct, fingertips drawing out, and then flex, scraping to the sky. So we're doing a big circle with our wrists, match my tempo nice and slow. And I have total body tension throughout my body, making sure nothing else is moving. Notice here the forearm's going to want to move around. Don't let it. That would be the elbow coupling with the wrist. Once you finish your second, reverse, flex, abduct, extend, adduct, and then flex. Take your time, self-assessing, but keep the motion smooth. Just 2 reps for our wrist cars. Now we're going to move on to our wrist capsule car. For the wrist, we just want to kind of simplify the movement. Often that position in supination can be tricky, so come into a neutral position. Grab onto your forearm to help you disassociate elbow motion from wrist motion. Good strong fist, and just give me 2 reps of rocking the knuckles down and then drawing them to the sky. Nothing else happening. 2 reps. Once you finish your second, come back to the middle, and we'll flex the wrist and extend the wrist. So we're kind of just breaking the motion down into its specific parts, getting a few reps in each direction, and educating the wrist to figure out the movement. Switching sides, same idea, knocking knuckles down, scraping knuckles up. Remember, there's some tension throughout the body, enough that nothing else is moving. Back to the middle, flex, and extend. 2 reps each. Now we move on to our elbows. Coming up to a tall kneel for me. Again, you can stand, sit in a chair, make sure the position's comfortable. For the elbows, we start with knuckles facing forward. Squeeze the elbows, trying to draw your knuckles to your deltoids. From there, pause, make sure nothing else moves, but supinate the elbows, flipping palms to shoulder and showing your knuckles forward. Imagine you wanted to show your palms outside of your shoulders. From there, slowly extend down. At the bottom, we'll reset. Pronate the elbows, knuckles flipping forward. Flex the elbows, squeezing to deltoids. Take your time, tension throughout the body. Supinate, palms showing out. And extend back down. Here we'll reverse from supination, flex. Try and keep those palms outside of the shoulders. Pronate, notice here, big sticky point. Can you get those forearms to actually turn over? Extend down. Supinate, flex, pronate at the top, and extend. So for the capsule car for the elbow, we want to bring that attention to rotation. So what we'll do is take one hand, block it right in the bicep, and squeeze. So engage some tension, actually locking yourself into elbow flexion. Good karate chop hand. And we're just going to work on pronating, showing the palm forward, and supinating, showing the palm out. Take your time. Really focus on getting as much motion here as possible, but remember not pushing through pain. Just 2, and then we'll flip sides. Blocking for elbow flexion, good engagement. Pronate, palm shows forward. Supinate, palm shows out. Really easy self-assessment here. Which side is better, pronation versus supination? Check in with the body. Again, always jotting down some notes when we do our cars. Now we'll move on. Gonna get the neck car. So I'm gonna show you from the kind of this side here. For the neck, squeeze those shoulder blades down, tension to the core and glutes. Starting with cervical flexion, nodding chin to chest. Rotation, turning the chin right, nothing else moves. How far can you turn? Make sure you're not pushing into that closing angle pinch. Drop the right ear down, lateral bend. And now extend, taking the chin to the sky. Opposite way, lateral bend, drop the ear down. Rotate, turn the chin. And now scrape along the collarbone. Back into flexion. Reverse from there. Flexion, rotate away. Max out rotation, nothing else moves. Laterally bend. And extend to the sky. From extension, we drop lateral bend. Rotate. Scrape along the collarbone, back into flexion. One more rep. Rotate. Drop the ear. Extend to the sky. Smaller motion than you think. From extension, drop the ear down. Rotate. And scrape through. Last half rep. Flexion into rotation. Can you see past your shoulder? Drop the ear down. Make sure we get that opening angle stretch. And finish through. So the neck car is a very good example of not wanting to go too far with our cars. The goal isn't how big the circle is, it's how much you can disassociate one from the next. So if I'm going as far as I can, we'll start seeing lots of coupling. Go smaller, focus on your tension, and make sure you're actually doing a neck car, not a global spine car. For the neck capsule, what I like to do here is just nods. Again, comfortable position, I'm just gonna show you from the low kneel. But lock your hands either down behind you like this if it's comfortable. If not, you can even grab onto kind of the pants and pull the shoulders low, but anchor your scapula down. And we're just gonna nod chin to chest. And then extend, pulling chin back into double chin, and then reaching, elongating into extension. Same idea, nodding into flexion. Great way to assess for closing angle pinching here in the neck. And then coming back into extension. Just 2 reps. So remember now, for our elbows, for our capsule car, we looked at rotation. For the spine, we'll always look at flexion and extension. Not to get too confusing, but for most joints, we want to prioritize rotation. For the spine, we take a step back and we prioritize segmentation. So, big self hug now, we're going to do our T-spine cars. Core and glutes are engaged. Flex the spine, trying to take your chest and pull it to your thighs. Here, imagine yourself as a dinosaur trying to show your spine to the sky. Max out flexion, just like the neck. Turn your chest right. Maxing out rotation, then side bend, drop your shoulder. Now extend, taking sternum to the sky. From extension, side bend, drop the shoulder. Rotate, turning left. And round back through to the floor. So from flexion, rotate. Side bend, make sure those scapula stay low. Extend. Laterally bend. Rotate. Back into flexion. So we'll get one more rep. The T-spine car can be tough from a kneeling position. You can do it sitting in a chair. You can also do it standing. I like to go wider with my feet. Second rep. Segmental flexion of the spine. Concave chest, trying to show those vertebrae to the sky. Rotating right. Turn the sternum, not just the neck. Laterally bend, drop that shoulder. Extend, taking chest to the sky. Side bend and rotate. Flex through. reversing directions, rotate, drop the shoulder, peel the sternum to the sky, side bend and rotate, and round through. So I just mentioned as we work on capsule cars, for the spine we want to look at flexion and extension. So T-spine car is a bit limited. Next we come to our global cat-cow. Now, this is going to look at global flexion and extension of the spine. If you've worked cat-cows before, the only difference here is we want to prioritize against segmentation. So we're looking at trying to move one vertebrae at a time as best as we can, not going as far as we can into our cat-cow, but working on controlling it as much as possible. So 2 reps, about 10 seconds each direction. Here, let's talk about that MVC, that irradiation. We don't want to be too high tension, but as I go into cat and I start flexing the spine, I want to drive tension forward through my hands. That's going to help me prevent my scapula jumping around. So as I round, I'm pressing hands forward, and as then I start peeling into extension, we're going to think about dragging our hands towards us. So we're going to kind of focus our tension. Big breath in. Starting in our pelvis, we're going to think about drawing palms towards thighs and then peeling tailbone to the sky, anterior pelvic tilt, start lumbar extension, pulling rib cage, sternum, collarbone to the sky, and finish with the eyes. Nice and slow, reverse the direction of the hands. So press your hands forward and now posterior pelvic tuck. Very slowly the lumbar spine flexes. T-spine, concave to that sternum and chest, maintain tension in your hands, upper back rounding, and finally chin to chest. Again, reverse the hands, dragging towards us now, anterior pelvic tilt, lumbar extension, low T-spine, peel that sternum, no change in hand position, lifting through the collarbones, finishing with the eyes, reverse the hands, pressing forward. This time lead with the neck, segmental flexion, T-spine flexion, slow, mid-back to lumbar, finish the pelvis. So now we come back to a kneeling position after our spine, and we're going to address the scapula. Scapula cars, we're going to do our best to keep our hands anchored to our thighs. Think of them as they want to stay here. Don't let them slide forward. Don't let them slide back. We want this motion to be led with the shoulder blades themselves, not with the hands. So some tension, core and glutes. Again, standing is fine if this is a lot on your knees. Big breath in and out. Radiate tension throughout the body. Glutes are engaged, core is engaged. Take your shoulder blades, reach them straight forward. Hands stay still. Shrug those shoulders to your ears. No bend in the elbows. Pinch the shoulder blades together and squeeze them down to your hip pockets. Go smaller than you think. Don't let those arms swing. Don't let the elbows bend. From scapular depression, now reverse. Retract, pinch back. Elevate, squeeze up. Protract, reach forward. Depress, squeeze down. Notice the hands drawing a circle. One more rep. Protract, elevate, retract, pinch, depress, squeeze down. Last rep, reverse from depressing, pinch back, squeeze up, reach forward, and pull down. So for scapular correctives, pretty similar actually to the wrist. We don't need to work on one specific movement. We just want to simplify. So what I like to do, grab your yoga block. If this is too narrow, you could hold your dowel, maybe something wider. If not, you can just go hands out. But something in between the hands is great to squeeze a little bit of tension. What we'll do here is work on protraction, retraction first, and then elevation, depression. So we're just simplifying. Some good tension, don't let the arms go up or down. Reach the yoga block forward. Protract, don't let your chest move. Pinch the shoulder blades together. Retract. Don't let the elbows bend. Protract and retract. Take your time. Now, hold retraction, squeeze that yoga block, elevate, take the shoulders to the ears. Try and maintain retraction so you're pinched up and back. Retract, and now depress, squeeze down to your hips. A little bit tough here. retract and elevate, retract and depress. So this is one that you can fool around with. You can put the hands in kind of any position. You can go out to the side, you can go behind you, but get used to moving those shoulder blades to their full range of motion. In the beginning here, it tends to be a little confusing. Similar to the T-spine card, it's tricky to get the idea. As you practice and get familiar, start to play around with different positions, find the one that works best for you. The shoulder is next. The shoulder is a big one. So the global shoulder card we'll do in a half kneeling position. Some tension radiating down, pressing through the leg, good karate chop hand. Here we want to really focus on rotation. So you're going to want to watch kind of my arm, my humerus, and you're going to want to notice the actual rotation occurring around the bicep, not just the elbow and not the scapula. So some good tension. Start flexing the shoulder. Rib cage is down. Stop before you think you need to. Elbow doesn't bend, ribs don't flare. From there, internally rotate. Turn your bicep and your palm, showing the palm out, bicep turning in. Try not to follow with your chest, but continue reaching, maxing out internal rotation. So palm showing to the sky as best as you can. Extension of the shoulder, keep internally rotating, turning palm out. Finish next to the hip. Try not to let that scapula really jump forward here. Reverse directions, extend the shoulder. Maintain that good IR, hold. Externally rotate, turn the bicep, palm follows. Thumb down, pinky forward, start reaching overhead. Squeezing tight to the ear and finish through. Second rep coming up, flex the shoulder. Good karate chop hand, no change in alignment. Max out flexion, ribs stay down, make sure that shoulder is low. Internally rotate, bicep turns, palm follows. Spin those knuckles forward as you continue to reach behind you. Palm to the sky. And finish the rep. Reverse, extend. Externally rotate. Abduct and flex. So for the shoulder capsule car, again, we want to prioritize that rotation. A lot of ways we can do this, and we'll definitely explore more. To keep it simple here today, staying in that half kneel, lock your triceps and make a tricep. I want you to do a lateral bend like our T-spine car. So take your ribs and pull them away. What this is going to do is allow gravity to sink our scapula down into depression, so our scap is low away from our ear. It's going to allow us to really lock the tricep, and then just really slowly, just give me a few reps of in this position, internally rotating and externally rotating. So I'm trying to turn my bicep. I'm showing the bicep out and then showing the bicep in. Throughout, my shoulder blade is depressed to the floor and my triceps engaged. I get a lot of good lat, get some anterior pec and some posterior shoulder. So again, that position, a little bit tricky. Side bend allows us to get that scapula away from our ear and help us prevent the shoulder blade helping. That allows us to make sure we can lock that elbow, and then just good axial rotations. That's our shoulder capsule car. Let's flip sides. Global shoulder car here for the left. Good tension, stiff arming down. Good alignment here. Rib cage is down, glutes are engaged. Flexing the shoulder, nice karate chop hand. Stop a little sooner than you think. Make sure elbow is locked, rib cage is down, head is still. Internally rotate, bicep turning, palm following. Reach behind as far as you can. Continue rotating. Palm turning to the sky. And then finishing down next to the hip. We reverse, extending the shoulder from internal rotation. Max out that position. Externally rotate. Chest stays forward, head is still. Pinky forward, thumb back. As we draw tight to the ear. Rep 2. Flexion into internal rotation. Freeze there. Make sure you get a little more IR. Keep turning. Don't get sloppy behind you. Maxing out IR and extension. Finishing next to the hip. Again, notice where that shoulder blade. Try not to let it be a scap car. Extend. Externally rotate, abduct, and squeeze tight to the ear. Into our capsule car, same idea. Side bend, Allow that scapula to sink. Good tension through the tricep. Internally rotate and externally rotate. 3-4 reps here, take your time. Shoulder rotation, actual glenohumeral rotation, tends to be tricky at first. I really like this position. It simplifies it. It allows you to feel what IR and ER really feel like. Okay, down to our toes next. Have a seat. Toes can be tricky if you've never worked on them before, but have a seat in a comfortable position. I like to kind of strap onto the shins and sit up nice and tall. What we'll do is try both feet at once, and then we'll regress to one foot. So our toe drill is basically, we're going to work on our big toe and our outer foretoes together. The big toe drill says a lot about the strength and control of your medial arch, your inner arch. The outer foretoe is a lot about your lateral arch. So big learning moment for many of us. Lift all 10 toes up, hold, place just your outer foretoes down. Big toes stay up tall. Make sure the ball of the foot stays down, heels down, lateral foot's down. Good tripod foot. All 10 toes up, big toes down. No change in foot position. Don't let your ankles jump around. Reverse. All 10 up, outer foretoes down, big toes stay up tall. Notice if you start pointing your fingers, those are not your toes. All 10 up, big toes down, all 10 up, outer foretoes down. Okay, relax. If that was very tough for you, you can regress sitting in a chair or standing. But I also like this one, not really a capsule card here, but I think it's a very simple regression. Just gonna bring that leg right here, go one at a time. So do your best to pick up just the big toe. Now if you can't do that, instead raise all 5 up and try and tap the 4 down and hold the big toe up strong. Either way, I want 3 reps, a big toe up and hold, or all 5 up, big outer 4 toes down. Okay, one more time, big toe up, or all 5 up, outer 4 toes down. Let's reverse now. Big toe stays down, outer 4 up, and relax. Tends to be a little bit easier there, so we'll just get that for 3. We'll switch sides. Toe drills tend to take practice. Motor control here, we don't work on it a lot. We spend a lot of time stuck in a shoe. We lose that foot dexterity, and the arches of our feet get very weak and limit everything up the chain. Work on your toes, you'll be amazed at how big a difference it'll make. Out, big toe up, tap it down, all 5 up, place the outer 4 toes down, hold that big toe up high, and reverse, big toe up, and down, all 5 up, outer 4 toes down, hold that big toe strong. One more time. And let's switch, just 3 reps, picking up outer 4, tapping back down. Again, if it's super tough, try it sitting in a chair or try it standing. Moving on to our ankles, left leg out of the way. Take your right thigh up, take your right arm underneath, grab onto your shin, grab onto your forearm, and then we choke out our thigh just like this. So we're holding our thigh passively in flexion. Our hand is here so we can disassociate knee motion from ankle motion. So nice and slowly, we're going to take our foot in, point the foot down, scrape the foot out, and draw the foot up. Big circle of the foot here. Trying not to let the shin move in your hands. Just 2, go each direction. Cracks and pops, very normal. Out, down, in, and up. If you have some kind of ankle issue or you've injured one before, you'll notice the ankle is going to want to shake and jump around. Slow down the reps, really slow here. Ankle capsule card, we stay in the same position. Point the foot down. All we're going to do here is get some good capsular rotation of the ankle. Basically, take your foot, point it in, take your foot and point it out. So we're getting good inversion and eversion of the ankle in ankle plantar flexion. Just get about 3. What you should get is a nice line of tension around that low ankle in each direction. Moving on to the left, scooping under, grabbing the shin, foot goes in, foot goes down, out, and up. Take your time. For me, much tougher on this side. Right away, I notice. Easy self-assessment. Once I get 2, I reverse. I have to really fight to control it. It wants to just skip around. So I'm taking my time, using the breath and my tension. Onto the capsule cars, plantar flex, foot draws in, foot draws out. get good inversion, eversion. I notice for me, really tough to get any eversion on this side. Maybe that's a note. Wow, my ankle's really struggling and everting on the left side. Later in homework, we address that more directly. Onto the knee. Knee cars here. If this position gives you a big pinch in your hip, it's just a lot of hip flexion to be here. What you can do instead of holding the thigh up like this is actually scoop around it kind of here, and it's going to require less hip flexion just to be here. Otherwise, you could take your pillow and just sit up on it. It's going to make it a little bit simpler. Either way, the knee car is similar to the elbow. So here we want to see the shin actually move. That's tibia motion, similar to the elbow, getting that forearm rotation. What we'll do, turn our foot in and try and turn our heel out. So what I'm doing there is trying to rotate my tibia in very slightly. I'll extend my knee up 2/3 of the way. Don't quite lock the knee. Then I'll rotate my heel in, my foot out, tibia external rotation, and squeeze the knee back down. Reverse, tibia IR, extend, tibia ER, and flex. Take your time. We don't want it to be a thigh motion, so make sure that thigh is not jumping in. Let's reverse, tibia ER, foot turned out, extend 2/3 of the way, foot turns in, back down, one more time. So for the capsule car, we want to obviously prioritize and focus on that tibia rotation. It tends to be very tricky at first. So leg out of the way, one arm behind, hand on the shin so you can feel for tibia motion. Good dorsiflexion. We're going to think about pivoting on the heel. We want to get some irradiation here. So draw your heel kind of back towards you as if you were squeezing your forearm. It should help you feel your hamstring slightly. Keeping that tension, turn your foot out and turn your foot in. For many of us, tibia IR, turning the foot in, getting that shin to follow is going to be very limited. That's okay. Easy self-assessment right here. Just get 3 reps. Good knee flexion, dragging heel towards you. ER of the tibia and IR of the tibia. If you have a history of a knee issue, guys, this is one you want to prioritize. Switching sides. So again, we can be here for our global knee car, or we can grab one like this, whichever position is more comfortable and doesn't give you any closing angle pinch. Tibia internally rotated, knee extends 2/3 of the way. Tibia externally rotated, flex back down. So it's kind of an oval motion. Take your time, very similar to our elbow. Tibia ER, extend, IR, flex. Try not to make it a hip motion. Right into our capsule cars. Good heel dragging back, feel that hamstring, IR of the tibia, and ER of the tibia. So for me on this side, I notice I have much more control of tibia rotation. Maybe another note, right knee, very limited tibia IR today. So we finish our knee capsule. And now last drill, we're gonna get our hip cars. So a lot of ways we can do hip cars. I like to do them in a quadruped position as I first start teaching. I just feel like in that position, you can really irradiate tension in the core specifically, and it helps to disassociate hip from low back. Having said that, quadruped can be a lot on people's wrists. So if it's too much on your wrists, feel free to go on your knuckles, or you can complete these standing or lying on your side. Hip cars. Quadruped position, just some good tension through our hands. What we're going to do, just like the shoulder, there's a lot going on here. The right hip's what we're working on. So heel to butt, engaging my hamstring, good tension in my hands. I flex my hip, drawing knee forward to elbow. Make sure I don't go too far and round my back. Abduct, open the hip up high. Make sure it's not a low back drill. Heel draws up, internally rotating. Extend, scraping through. From there, we'll reverse. Knee touches down. Extend. Externally rotate. Heel drops, knee drives out. Scrape to the elbow, go slow. Not about how far you can go. Draw into hip flexion. And reset. Forward, out. Heel leads the way. Extend. And reverse. Extend. Externally rotate. Good tension in the hands. Abduct. And flex through. So for the capsule car, we're going to come down to a lying position on our side. So lay down on your side, kind of like you just woke up. So laying, head supported here, hands just pressed down. If this isn't comfortable for you, please lay on your side is comfy. We're going to take our hip into that weak point position and prioritize internal and external rotation. So flex, abduct, freeze right there. Couple reps of just internally rotating, driving your heel out, externally rotating, driving your heel in. IR of the hip is your thigh actually turning in. Watch the thigh. ER is your thigh actually turning out. Take your time, tougher than it looks. Switching to the left hip. Good tension in the hands. Flex the knee. Knee to elbow, abduct, internally rotate, and extend. Knee taps down, reverse, extend. Externally rotate, heel drops, knee drives, abduct. Fight for the elbow. Don't let those elbows bend here. One more rep. Internally rotate and extend. Extend and externally rotate. Keep that knee and heel up high. Fight through. Back down for those capsule cars. Sideline position. So the reason we're in the sideline position is to make sure the back doesn't turn. We work that hip capsule, that hip rotation. Really common, we see the low back following. Here, it's much easier to tell if you feel your low back really drop backwards. So take your time, make sure you're disassociating hip motion from everything else. Flex, abduct, hold strong, internally rotate, heel drives back, knee stays up high. Externally rotate, heel draws forward, knee drives out. Easy self-assessment. Are you more limited in IR or ER in this position? All right, so that is the end of our cars and capsules routine, our week 1 homework. You're to complete it every day this week. Strongly suggest jotting down a note here and there. You're going to learn a ton about your body.